if a mother is infected with the virus and she's pregnant, a safe way to like have the baby would be a C-section, right?
Or if the mother, if a woman is pregnant or knows that she's pregnant, it's important for her to seek medical attention because pregnant women are screened for HIV when they know that they first become pregnant. So if a mother screens positive for the virus, at that time she can begin taking the medicine. The medicine now, I believe, somewhere approaches a safe pregnancy of 90% or higher for the baby to be born vaginally, if that were an option. For a mother that's receiving the medicine throughout her pregnancy, we can a lot of the time deliver the baby vaginally without an increased risk of the child contracting the disease. So it varies just depending on whether the mother is being treated or not. Otherwise, a C-section in someone with an unknown HIV status that is in labor and tests positive at the time she's in labor, a C-section is often done to protect the baby.
One question, there's no visible signs that anyone has HIV, right? None at all.
When you first acquire the infection, there is a syndrome that's very difficult to detect called the acute retroviral syndrome. It looks like any common cold, and not everyone even gets this syndrome. And when it does present, you just get a little bit of a fever, maybe some joint muscle pain. Sometimes there's a rash. That would help us pick it up, but it's still a very difficult thing to pick up. And it goes away in a couple days, just like any common cold. So people think they just got a cold and got over it. And once again, this doesn't happen to everyone. Usually you have no symptoms with HIV. You can go on like that for months to years until the virus drops your immune system down so low that you start getting other infections, and then you show up to the hospital with these other infections.
Okay. Now, this disease has been around for a pretty long time, about 30 years. How has the treatment evolved from back in the days to today? And what exactly is today's treatment for someone who may catch the virus?
The treatment for HIV currently, so HIV is traditionally treated with a number of different medications used at the same time. So it's a combination treatment basically, where you use a number of different kinds of medications that attack the virus in its various stages of replication in the body. So previously, treatments would comprise several different pills being taken at the same time, and these had to be taken numerous times throughout the day. So treatment now has evolved in that we have newer drugs, because the HIV virus it's a pretty smart virus in that it mutates and adapts and becomes resistant to some of the older medications that we previously used. So nowadays we have newer drugs, and we've also combined numerous drugs into one pill. And the formulations nowadays of these pills allow for fewer dosing requirements, meaning that you can either take it fewer times per day, sometimes even just once a day. And that pill contains a number of different drugs in it. But it's still necessary to take these medications on a daily basis and not miss doses.
What is the name of some of these pills today that you have available for?
A lot of the drugs that we use today, most commonly, if somebody was to just present randomly, assuming the virus is sensitive, we would try a combination usually of something called tenofovir, efavirenz, and emtricitabine. Those are the three drugs that have been combined into one pill. And this has been proven to be very effective against most. There are many, many other drugs. Those three have very little side effects. Some of the other ones do have side effects, but there are other combinations that have also been combined into a single pill, so it's become much easier to manage.
So, can you give an example of like some of the side effects that the pills might give a person?
Sure. So some of the different classes of drugs can cause laboratory abnormalities, things that we'll see in the blood, like you can have hyperglycemia or hyperlipidemia. Some of them can make you feel tired and fatigued, some of them can make you feel nauseous. But once again, we've come a long way and we're reducing all of these side effects.
Well, thank you guys for your time, for spending time with us and educating us. Because on this show, we also like to inform and educate guys.
Yes, sir.
So, thank you for chilling with Loud and Lyrical. Your boy Mike on the mic.
Boy Luke, signing out.
Signing out.
So, hey, Mike, how's that final?
It was pretty good. I feel like I studied. I felt good about it, you know. I felt like I did good.
Yeah, man, good to see you doing good.
Gotta get the education.
Right. Thank you for watching, guys. I hope you guys are a little bit more aware, and I hope you guys have learned. If there's anything that you didn't know, I hope we answered some questions by this show we did, the segment. And just, make sure to live for today and plan for tomorrow.
You never know. Like, sex is a big step in a relationship, but you guys should always use protection. It's the smartest thing to do. Get educated, guys. Educate yourself on this virus even more.
Use your heads, guys. And if there's any further questions, you can go to AIDS.gov. They have a list of questions already answered for your knowledge. Yeah, you could get informed there about any further STDs, AIDS, or HIV. And we really appreciate you guys watching.
Tune in, Loud and Lyrical. Signing out.